Hi, I'm Ali Crossley. This is my lumbar spine examination video. So I'll start by asking my patient, is it okay if I examine your back today? Is that a problem?
No, that's fine.
That's fine. So gain consent. I'd also like to ask past medical history. So I would go through things like previous surgery, previous injuries, medications, any other medical problems before I start. Okay, so first off, can I get you just to walk over there?
Yeah.
And then turn around and walk back towards me. That's great, thanks very much. So that's just looking at the gait, looking for any sort of antalgic gait, having a look at the swing and the stance and things. You could also examine the pelvis, so from the side on, seeing if there's any pelvic tilt, and examine the patient's footwear. It's here, so look for abnormal wear on the soles, which might suggest a problem with the gait also. So, if you just like to turn around, first start by inspecting the back. So looking for any asymmetry, any scars from previous surgery, fasciculations, muscle wasting, and that all appears to be fine. Ideally, you would fully expose the back of the patient so that you can see everything really. And then if you turn side on this way, you have a look for the normal lordosis, the lumbar lordosis, and then the thoracic kyphosis, and again the cervical lordosis. So that all appears fine. And then if you turn to face away from the camera, you can have a look for any scoliosis, so S shapes of the spine. Again, everything appears to be normal. I'll now just palpate, so I'm going to press down your back. If it's painful, let me know.
Okay.
Hands free, isn't it?
Yes,
Any of that painful at all?
okay. No, that's fine.
So right down to the sacrum. And also palpate the paraspinal muscles. See if there's any muscle spasm or pain there. Any of that painful at all?
No, that's fine.
Okay, so that's palpation. So now I'd like you to get to do some movements. So if you turn sort of side on here, if you go forward and put your hands down the front of your legs and see how far you can go. So that's forward flexion. That's perfect. And then come back up to a neutral position. I'm just going to hold your pelvis, and if you just lean back towards me as far, extend your back as far as you can, and lean back over forward. Lean back towards me, sorry. Okay, that's fine, that's extension. And then if you turn side on this way, turn with this hand, if you slide all the way down that side, so lateral flexion, and then do the exact same on the other side. Okay, so lateral flexion appears to be good. And if you'd like to go around that side and sit on here facing away from me, just to check rotation, I think it's better to stabilise the pelvis here so you can't use your pelvis to turn as well, but this is to check rotation of the spine. So if you'd like to turn over this shoulder as far around as you can, that's grand, and then same on the other side. Perfect. So that's rotation of the spine. Now I'd like you to, if you can, just lie flat on your back. I'm going to check that's in shot. Okay, that's fine. So if we start with a straight leg raise, so if you keep this knee straight and just lift this leg off the table so as you can, that's very good, and pop it back. And the same with the other side. And put it down. So if you just do this one again, you can do a sciatic stretch test by dorsiflecting the foot. Is that painful at all? No? That's grand. So now check tone. So I'm just going to move your leg. Checking that the tone's normal, and that all appears to be normal. And for power, what I'd like you to do is keep your knee straight and try and lift your leg off the bed. And I'm going to try and resist that. You try and keep your leg up in the air. And now push your leg down towards the table, that's fine. And same on the other side. And back down. So that's hip flexion and extension, both 5 out of 5 power. If you'd like to bend this knee, and start off by trying to bring your heel towards your bum. I'm going to resist that, and then kick out against me. So that's knee flexion and extension. Same on this side. And then push out. That's brilliant. And then if you bring your toes up towards your nose, and then push your feet down, and then just with your big toes, bring your big toes up towards your nose, and push down again. So that's ankle, plantar and dorsiflexion, and looking at S1 with the toes. Okay. So that's power all 5 out of 5. Now I'm going to check your sensation. So what I'm going to do is I'm going to touch your leg, both legs at the same time. This is what it will feel like. That feel normal? And just tell me if it feels the same on both sides. So L1,
Yeah.
L2, 3, 4, 5. That feels normal on both sides.
Yeah.
So that's sort of gross touch. You could do light touch with cotton wool and a neurotip for pain. But for the purpose of this examination, I think that's adequate. I'm just going to next check your coordination. So what I'd like you to do with your right heel, if you take it all the way off the table, place it on your right knee, and slide it down your shin, then bring your foot all the way off and back onto your knee and slide it down again. So that's checking coordination. And then if you just do the same with your other leg, that's perfect. And now what I'm going to do is check proprioception. So I'm going to use your big toe for this. So what I'd like you to do is close your eyes. I'm going to hold your toe here. For the purpose of this, that is up, that is down. Okay? So you keep your eyes closed. I'm going to move your toe and tell me where that is. That's fine. And you do the same on the other side. Now to check reflexes. So I'm going to, you haven't got any pain in your knees or anything? I'm going to tap your reflexes, so your knee and your ankle, and then tickle your foot, I'm afraid. Okay. I might just run this side for the purpose of, you can see. So knee-jerk reflex. So let your leg go completely floppy. Let your leg relax. I'd have to do it from this side really to relax the leg properly. Let it go completely floppy. Okay. With your ankle, if you just bend your knee outwards this way, I'm just gonna, that's good. Same on this side. Just let your leg relax. That's fine. And just straighten your legs up again. And I'm afraid I'm going to have to tickle your feet just to check planters. That's normal downward going planters. Okay. And just regarding power, I just need to also check your abduction and adduction of your hip. So what I'd like you to do is with this leg, keep your knee straight and try and bring it out this way. So abduction. And I'm going to resist you, okay? And then bring this foot back towards your other foot. That's fine. And same with this one. So bring it out that way. Okay, and then bring your feet back together. That's perfect. So that's just to check power of abduction, adduction, which I missed before when I was checking the power of everything else. You can sit up, that's fine. To complete the examination, ideally, you should do a PR examination to exclude things like cauda equina. I'm not going to do that today for the purpose of this video. You also may request imaging, so plain radiographs, progressing to MRI depending on what pathology you suspect on your examination. That concludes my lumbar spine examination. Thank you very much for helping.